Digestive pain can be very uncomfortable, but most people assume their problems are caused by eating a bad meal or maybe even stress. But what they don't know is that it could be a symptom of something worse. So joining me now is Dr. Roshini Raj, a gastroenterologist with the NYU Medical Center, along with 27-year-old Julie Dubois, who was diagnosed with EPI 4 years ago. Good morning to both of you.
Good morning.
Thanks for being here. EPI is something I have not heard of before, and I think a lot of our viewers have never heard of. What is it exactly?
So EPI stands for exocrine pancreatic insufficiency, and this basically means your pancreas is not functioning the way it should be, which leads to poor digestion. So many patients with EPI experience abdominal pain, bloating, or diarrhea, and these are quite common GI symptoms. In fact, a recent survey done by AbbVie showed that 7 out of 10 Americans do experience some of these GI symptoms at least a few times a month. However, over half of them never discuss it with their doctor. And that's why we're here today, to really encourage people to listen to their gut, and that means take these symptoms seriously, speak to your doctor, because you may have an underlying medical condition that needs to be diagnosed, but also you'll feel better if it gets diagnosed and you get treated.
Well, I think that's a great message to people, because it's so true. Sometimes you just eat bad food, you don't feel great, or you're with someone who's not feeling great, and you just assume that it was the food. There's nothing more underneath it. Is EPI something that's relatively newly diagnosed, and is it often misdiagnosed with like a Crohn's disease?
Well, I don't know if it's like a new phenomenon. It's certainly been around for a while, but I do think it's certainly under-recognized. And yes, there are many conditions, including Crohn's disease, celiac disease, other things that can have very similar symptoms. So it's not the easiest thing to tease out, and that's why you really need to work with your doctor closely. Certainly, describe all your symptoms. Don't be embarrassed about talking about this stuff. And they will go through an extensive history and physical, probably order some lab tests and maybe even some imaging tests to try to get to the right answer.
I think it's great, Julie, that you're here talking about living with EPI. You were diagnosed 4 years ago. Talk a little bit about what led you to go in and become diagnosed.
Well, when I was about 14, I started having a lot of GI problems, and they progressively got worse. And when it got to the point where I was having pain after every meal, having to schedule bathroom breaks around ballet class, for example, and I actually ended up losing a lot of weight, I decided I needed to speak with my doctor to get the right diagnosis so I could get treated.
And what do you do now with the diagnosis to make sure that your digestive health stays on track?
Well, besides being compliant with the treatment plan, by changing my diet and taking medication, I think having an open communication with your doctor is important, because your treatment may need to be adjusted, and I speak with my GI doctor very regularly just to make sure that I'm kind of staying on track with how to manage my symptoms the best way.
And Dr. Raj, is it true that EPI really kind of stems from your pancreas not creating certain enzymes, correct?
That's exactly right. And then what causes that, it could be due to some other underlying issue like pancreatic inflammation. We call it chronic pancreatitis. It could be related to diabetes, even pancreatic cancer. So it's important to get the right diagnosis, and there's a website called identifyepi.com that talks about some of the symptoms, but also gives you tools to keep track of the symptoms and things you can bring to your doctor, bring to that first visit, and ask the right questions.
And for you, Julie, what do you suggest people who live with digestive problems? What's your advice to them?
Not be embarrassed. Really take control of your gut and talk to your doctor, because they hear it all the time. It's not something new that they're going to be shocked that you're talking about. Just have a really open communication so you can get the best possible treatment.
All right, I think it's great that both of you raised some awareness today about EPI, and I'll make sure to give that website again. Thanks for being with us here on the Morning Blend.
Thanks so much for having us.
Absolutely. And to learn more about EPI, you can visit the website that they mentioned. It's identifyepi.com.